Have you ever wondered if something as private as relieving yourself every day could secretly protect your prostate, or slowly wear it down? For many men over 60, this isn't a trivial question, it's a turning point for health, confidence, and even independence. The prostate may be no larger than a walnut, yet it controls how you urinate, how you function as a man, and how comfortable you feel in your own body. What most men don't realize is that one simple habit, done regularly, can either ease pressure and prevent congestion, or disrupt your hormones and leave you fatigued. In this video, we'll uncover 3 hidden effects daily release has on the prostate, and why the third one might save you from years of discomfort. Stay tuned, and don't forget to subscribe for more honest men's health insights. 3 biological mechanisms affected by daily masturbation. When men ask me whether daily masturbation is good or bad for the prostate, I never answer with a simple yes or no. The truth lies in how your body actually responds, not emotionally, but biologically. Inside the prostate and the surrounding pelvic region, 3 major mechanisms are affected each time you release: hormones, circulation, and immunity. Understanding these 3 changes will help you see why this habit can be both protective and, if overdone, potentially draining. Mechanism 1. Hormonal shifts and DHT relief. The first mechanism has to do with hormones, especially a powerful one called dihydrotestosterone, or DHT. This hormone is a derivative of testosterone, and while it helps maintain male features such as muscle tone and facial hair, it also plays a major role in prostate growth. Men with consistently high DHT levels are at greater risk of developing benign prostatic hyperplasia, commonly known as prostate enlargement. Here's where daily release comes into play. Research shows that after orgasm, DHT levels in the blood temporarily decline. You can think of it as giving the prostate a short break from constant hormonal stimulation. For men who are prone to enlargement, these small breaks may reduce the overall burden on the gland and ease long-term pressure. But there's a balance. If a man forces himself into constant, high-frequency release without adequate recovery, the endocrine system, the delicate axis of the brain, pituitary, and testes can become destabilized. Testosterone production may waver, and men entering andropause, the male version of menopause, may notice deeper fatigue, mood swings, or slower recovery. So, while moderate release offers hormonal relief, overdoing it may create new challenges for the very system you're trying to protect. Mechanism 2. Muscular contractions and blood flow. The second mechanism is mechanical rather than hormonal. During ejaculation, the prostate and the surrounding pelvic floor muscles contract rhythmically. These contractions are not random, they serve a biological purpose. They squeeze out prostatic fluid, push blood into smaller vessels, and stimulate local circulation. Better blood flow means better nourishment for the gland. Oxygen reaches tissues more efficiently. Waste products are removed, and the gland stays softer and more elastic. Think of it like stretching your muscles. Use them regularly, and they remain flexible. Neglect them, and they stiffen. Daily activity can therefore act as a natural massage for the prostate, improving its resilience. This is one reason why some studies, including those from Harvard, suggest that men who ejaculate more frequently may lower their risk of developing prostate cancer. The gland simply doesn't sit idle, it keeps moving, flushing, and refreshing itself. However, too much of a good thing becomes a strain. If the pelvic floor muscles are forced into constant contractions without proper rest, they can become fatigued. This may lead to tension and weakness in the area, showing up as reduced urinary control, dribbling after urination, or aching in the pelvis. Older men are particularly sensitive to this because muscle recovery naturally slows with age. Moderation is once again the key enough to keep blood moving, but not so much that you exhaust the very muscles that support bladder and prostate function. Mechanism 3. Local immunity and waste clearance. The third mechanism is perhaps the least understood, but it may be the most important. The prostate is not just a fluid reservoir, it also participates in local immune defense. Inside the gland, old cells, proteins, and microscopic debris accumulate under normal conditions. Part of this material is cleared during ejaculation, when fluid is expelled. So is waste that could otherwise irritate the gland. This process helps reduce low-grade inflammation, the type that doesn't show up as an infection but can cause nagging discomfort, that dull ache or heaviness many men describe in the lower abdomen or groin. By releasing regularly, you essentially give your prostate a rinse, reducing the chance of chronic irritation. But again, timing matters. If release is too frequent, the immune system may not have enough time to reset between cycles. Instead of cleansing, the process may become dysregulated, leaving the gland in a state of persistent low-level inflammation. Symptoms can include heaviness in the pelvis, discomfort during sitting, or a vague sense that the bladder never empties completely even if scans and tests appear normal. At first glance, these explanations may sound overly clinical, but the effects are far from abstract. Every week, I see men whose prostate health has been directly influenced by how often they engage in ejaculation. Some enjoy stable urinary patterns and confidence in intimacy because they maintain balance. Others suffer years of discomfort simply because they neglected their body, either through total abstinence or through patterns of excess. Consider this. The prostate is only about the size of a walnut, yet it governs crucial functions that define daily comfort: urination, erections, and even the sense of masculine confidence are tied to its well-being. Small habits, like whether or not you allow fluid to move through it regularly, can shape decades of health outcomes. What, then, should a man over 60 take from these three mechanisms? The first truth is simple. Ejaculation is not childish, nor is it shameful. It is one of the body's natural maintenance tools. Each release provides a brief pause from hormonal pressure, keeps blood moving through the pelvic floor, and helps the prostate cleanse itself of waste. In that sense, it is not just pleasure, it is prevention. The second truth is about balance. Younger men may tolerate daily release, but as the decades pass, recovery matters as much as the act itself. Too little activity and the gland becomes stagnant. Too much, and the system grows weary. The goal is steady rhythm, not extremes. And finally, awareness is the real key. Don't rely on old myths or silence. Look instead to biology. Your prostate thrives when it is given attention, moderation, and care. Neglect, whether through embarrassment or denial, only opens the door to long-term problems. To make this real, let me share the story of one of my patients, a man who thought abstinence was the safest path, but instead discovered that avoiding release was slowly stealing his comfort and his confidence. His experience shows just how much these small biological truths can shape the course of everyday life. Sometimes, the science makes sense on paper, but it's a single patient's journey that truly brings it to life. Let me share with you the story of Michael, a 66-year-old retired construction supervisor from Nevada, who came to see me after months of discomfort he couldn't explain. Michael had always been a strong man. Decades of managing heavy equipment and long days under the desert sun had built him into someone who prided himself on resilience. But when he sat across from me, that confidence was gone. He confessed he was waking up 3 or 4 times every night just to urinate. His bladder never felt empty, and there was a dull heaviness deep in his lower abdomen that never seemed to lift. "I don't feel like myself anymore, Doc," he told me. At first, his symptoms sounded like the usual signs of an aging prostate: frequent nighttime urination, weak stream, that nagging pressure in the pelvis. But when I asked him about his lifestyle, something surprising came up. He admitted, almost embarrassed, that he hadn't ejaculated in nearly 10 years, not with a partner, not alone. After turning 55, he decided that intimacy was behind him. "I thought it was normal to stop," he said quietly. "At my age, I figured that part of life wasn't needed anymore." We ran the necessary tests: a physical exam, PSA blood work, and an ultrasound. The results revealed what his body had been hinting at all along. His prostate was moderately enlarged. His PSA levels were higher than normal. The gland tissue showed signs of swelling and early irregularity. It wasn't cancer, and it wasn't a crisis yet, but it was the body's way of saying, neglect has consequences. I explained to Michael that the prostate is not a silent organ. It continues to produce fluid whether or not a man chooses to release it, without regular emptying. Congestion builds, tissue stiffens, and inflammation quietly smolders. Abstinence hadn't protected him, it had left his prostate stagnant. Together, we built a new plan, nothing extreme, just small, steady changes. Drinking more water during the day, less alcohol at night, light daily exercise to improve circulation, a supplement routine with zinc and antioxidants to support the prostate, and most importantly, reintroducing ejaculation once or twice a week in a way that felt comfortable and natural for him. At first, Michael was hesitant. He admitted he felt awkward even trying, but after a few weeks, he noticed something. The pelvic heaviness began to ease. By his second follow-up, he was waking only once at night instead of 4 times, within 4 months. His PSA levels dropped slightly, his urinary flow improved, and he described feeling lighter in his body. But what stood out most wasn't just his lab results, it was the shift in his outlook. He carried himself differently. He was no longer embarrassed to discuss intimacy or prostate health. I thought this chapter of life was over, he told me. But I see now it's part of taking care of myself. Just like eating right or going for a walk. Michael's journey is not unusual. I've seen countless men in their 50s, 60s, and 70s make the same mistake believing that shutting down sexual activity is safer, cleaner, or more dignified. In reality, the body doesn't retire. The prostate continues its work, and without regular release. The price is often discomfort, sleepless nights, and loss of confidence. His story is a reminder that caring for the prostate isn't just about medical tests or supplements. It's also about respecting the body's natural rhythms. What he once thought of as unnecessary or even shameful became, in fact, a simple act of maintenance, one that gave him back his comfort, his rest, and a piece of his identity. As we move forward, keep Michael's lesson in mind, because the question that follows naturally is the one every man asks. How often is enough? That's what we'll explore next, the recommended frequency of release by age group, so you can protect your prostate without pushing your body too far. One of the most common questions I hear from men after we discuss prostate health is this: so how often should I release? It's a fair question, but the answer is not one number that fits everyone. Frequency depends on age, overall health, and how quickly your body recovers after each ejaculation. Still, clinical observations and years of patient experience allow us to give general guidelines that work for most men. Ages 40 to 49, 3 to 4 times a week. In this decade, hormone levels remain relatively strong, and the prostate recovers well after activity. For many men, releasing 3 to 4 times a week is not only comfortable, but beneficial. At this stage, the gland thrives on regular flushing. Blood flow is robust, testosterone is steady, and the tissues remain elastic. Think of it as preventive maintenance. By staying consistent, you're reducing congestion and keeping your body in rhythm. Men in their 40s who stop altogether often find that their prostate symptoms appear earlier than expected. By contrast, those who maintain a regular, moderate routine usually enjoy fewer urinary complaints as they move into their 50s. Ages 50-59, 2 to 3 times a week. By the time men reach their 50s, changes begin to surface. Testosterone levels start to dip, recovery slows slightly, and the risk of benign prostatic hyperplasia increases. In this stage, 2 to 3 times per week tends to strike the right balance. The key here is listening to your body. If you notice that you feel fatigued, achy, or irritable after release, it may be a sign that your system needs more recovery time. Conversely, if you go weeks without activity and begin to experience pelvic heaviness, more frequent urination, or difficulty emptying your bladder, it's time to increase the frequency again. I often advise men in this group to avoid extremes. Long stretches of abstinence can increase stagnation, but daily release may feel draining. Balance is the medicine. Ages 60 and beyond. Once or twice a week. For men over 60, the body's recovery window grows longer. The prostate remains active, but the muscles around it, especially the pelvic floor, are more sensitive to fatigue. At this stage, once a week is generally enough to maintain circulation. Flush the gland and keep biological rhythms in check. If your overall health is strong and your libido remains active, twice a week can still be beneficial. What you should avoid are back-to-back sessions or forcing frequency beyond what feels natural. Overexertion can leave you feeling sore, tired, or even worse in urinary control. Many older men fall into one of two traps. Either they stop completely, believing sexuality is over, or they push themselves daily out of habit from younger years. Both paths can cause problems. The first invites stagnation and discomfort. The second risks exhaustion. The middle path, gentle. Consistent rhythm is the one that keeps the prostate healthy without straining the system. No matter your age, the most important principle is consistency. Don't let weeks turn into months without activity, but don't push yourself beyond what your body can comfortably handle. A prostate that receives steady, moderate attention will serve you far better than one that is either neglected or overworked. This habit should also be paired with other pillars of health: balanced nutrition, hydration, light exercise, and regular checkups. Ejaculation alone is not a cure-all, but when combined with these factors, it becomes a natural part of whole-body maintenance. Some men feel anxious hearing these numbers, worrying whether they're doing too much or too little. My advice is simple. Use these guidelines as a compass, not a cage. Your body speaks to you. If you feel refreshed, if your sleep improves, if urination becomes easier, you're on the right track. If instead you feel drained, tense, or restless, it's time to adjust. Above all, remember that frequency is not about performance or youth, it's about care. A man in his 60s who maintains gentle weekly release is not trying to prove anything, he is practicing self-respect. And self-respect, at any age, is the cornerstone of lasting health. As we move to the next part, we'll explore another barrier that often holds men back from following these simple guidelines. It isn't lack of knowledge, and it isn't lack of ability. It's something more hidden, more personal, the weight of shame and silence that keeps men from doing what their bodies need. And until that barrier is broken, no guideline in the world will truly take root. For many men, the greatest obstacle to maintaining prostate health is not medical. It is not the level of hormones, or the strength of the bladder, or even the size of the gland. The heaviest barrier is silence, the quiet wall of shame that keeps men from acknowledging their needs. From a young age, boys are often taught that sexuality is something to hide by the time they reach their 50s and 60s. That message has hardened into a belief that masturbation, especially in later life, is somehow wrong or embarrassing. I have spoken to countless patients who admitted that even when they sensed something was off in their bodies, they chose not to ask, not to talk, not to act, all because they felt too uncomfortable. One man in his 70s once whispered to me, "Doc, I thought I was the only one." He had lived for decades with the idea that releasing alone at his age was strange, almost shameful. He endured restless nights, frequent urination, and pelvic pain, never realizing that a simple, natural act could have brought him relief. His silence cost him years of comfort. The truth is this: masturbation in older age is not a weakness, not a betrayal of dignity, and not a childish behavior. It is, in fact, a basic form of maintenance as natural as walking for your heart or stretching for your back. The prostate does not retire when you turn 50 or 60. It continues to produce fluid, continues to participate in your body's rhythm. To ignore it, simply because society frowns upon the topic, is to invite unnecessary suffering. Cultural pressure plays a powerful role. In many households, men are raised to believe that talking about sex is inappropriate. Partners may unintentionally reinforce this, assuming that intimacy should fade with age. Religious or moral beliefs sometimes add another layer of guilt. The result is predictable. Men keep quiet, avoid discussion, and silently accept discomfort as their new normal. But silence does more than hide the truth. It creates fear. Fear of being judged, fear of appearing weak, fear of admitting that the body still has needs, and in that fear, men abandon the very habits that could protect them. What changes when men break this silence is profound. I have seen patients walk into my office, shoulders heavy with embarrassment, and leave standing taller simply because they dared to speak openly. Once they understood that their situation was not unusual, that their body was behaving exactly as biology intended, the weight lifted. They realized they were not strange, they were simply human. Shame is powerful, but it can be dismantled, and the way to dismantle it is through awareness and conversation. Videos like this, articles, support groups, and honest conversations with a trusted physician all chip away at the stigma. Each time a man speaks, another man listens and finds the courage to care for himself. It is important to remember, the goal is not indulgence, but balance. Nobody is saying that a man in his 70s should force himself into daily release. The message is simply this: do not abandon your prostate out of shame. Give it the attention it needs, in the measure that feels right for you, by reframing masturbation as self-care rather than secrecy. We return dignity to the conversation. A man who maintains gentle, consistent release in later life is not clinging to youth. He is practicing health, prevention, and respect for his body, and there is nothing shameful in that. So as you reflect on the guidelines we discussed earlier, ask yourself this: is shame holding you back? Are cultural voices drowning out the needs of your own body? If so, remember that biology doesn't judge. Your prostate doesn't care about stigma. It simply needs rhythm, balance, and care. As we move into the final part of this discussion, I want to leave you with encouragement, because what matters most is not only the science or the frequency, but the attitude you bring to caring for yourself. In conclusion, we'll tie everything together and highlight the small, powerful actions you can begin today to preserve not just your prostate, but your confidence and quality of life. We've traveled through the science, the stories, and the struggles. Now it's time to step back and see the bigger picture. First, remember the 3 mechanisms we discussed. Each release gives your prostate a short break from hormonal pressure, keeps blood circulating through the pelvic floor, and helps clear out cellular waste that would otherwise irritate the gland. These aren't abstract ideas. They are simple biological truths, proven by both research and patient experience. Second, remember Michael's story. A decade of neglect left him with sleepless nights and a heavy, swollen prostate. But with small changes, hydration, exercise, supplements, and most importantly, gentle reintroduction of regular release, his health turned around. He didn't need radical treatments. He simply needed balance. Third, take to heart the guidelines by age. Men in their 40s may do well with 3 to 4 times a week. Men in their 50s, 2 to 3. And men over 60, usually once or twice is enough. These numbers are not rules carved in stone, they are guides. The real measure is how your body feels, how it recovers, and how steady your rhythm remains. Finally, let's not forget the most hidden barrier of all: shame. Too many men withdraw into silence, convinced that self-release in later life is somehow wrong. The truth is the opposite. It is maintenance, not weakness. It is dignity, not embarrassment. Your prostate does not stop working with age, and neither should your care for it. So, what should you do today? Start with awareness. Pay attention to your body. Find the rhythm that gives you rest, relief, and confidence. Pair it with good nutrition, light exercise, and regular checkups. And most importantly, don't let silence dictate your health. If you've stayed with me this far, I believe you're serious about protecting your vitality. Leave a comment below, share your age group, or your biggest concern about men's health. And don't forget to subscribe, so you'll never miss the insights that can keep you strong, balanced, and confident in every stage of life. Your prostate may be small, but the care you give it shapes the quality of your years. Respect it, and it will respect you back.